I do want to ask you, and you said earlier about these three nerve endings or pathways. What did you use?
Pain nuclei.
Pain nuclei.
Yeah.
Now, when you were practicing and you were talking about these teeth that were in a form and you would drill, how do you know how deep to go before you would hit those pain
Well,
receptors?
the pain nuclei, if you touch a tooth, you feel pain. If I blow cold air on your tooth, it hurts, right?
Correct.
Yeah. So there is a connection. See, it's an organ. Let's get that
It is.
right out. It's an organ. It's
Yeah.
not a dead piece of, tooth, as people like to think. It's an organ. It's alive. It has a lymph system, it has a nervous system, and it has a blood supply, a blood system. So
Wow.
all of those are circling to the tooth with millions of little tiny canals, and each canal is filled with a cell. Those canals go from the inside of the
The
tooth.
canals are filled with a cell?
Yeah, the canals go from
Yeah.
the inside like a nerve,
Okay.
like a
Yeah.
nerve arm,
Okay.
right? So it goes from the inside to the outside, and inside that. So millions of them, miles of canals in your tooth. So those help you feel pain, hot, cold, and around the tooth is a ligament that makes you feel proprioception. And when you bite on something, you feel the tooth moving. That lets you know that you're biting together.
Yeah.
So it's a very complex organ. When that organ dies, meaning you cut the blood supply off on the bottom, no blood supply, it dies. So if I take your kidney and I clamp off the blood supply, the kidney
Correct.
dies.
Yeah, you
Liver
bet.
dies, right?
Yeah.
It all dies. So it's a organ with all this dead tissue inside. It's got dead cells, millions of them. It's got connection from the outside of the mouth, where you chew, where all the bacteria is, to the inside of the mouth through millions of little canals.
Correct.
It's a connection.
Correct.
And all that stuff rots. When something rots, okay, it is bacteria food.
You bet.
Bacteria food
You bet.
is a bad thing, right? Bacteria release metabolites or toxins, and those things poison you. We'll get into that in a little bit more detail.
Yeah, because if the temperature of the mouth has a certain temperature, that
Oh, yeah.
will accelerates it.
It's the best place for bacteria to grow.
Yeah.
And they grow wherever they can. They hide, right? They want to hide from your immune system. If you were to hide from the immune system, where would you go? You go in a dead organ that has an endless food supply that cannot be reached by your immune system because it's outside the body, yet in the body at the same time.
Correct.
And around it is a ligament that now is also dying. And below it is a opening that used to be a connection into the main blood supply that now is also dead. And gravity pulls all that poison, just drips right down the bottom, out into the bottom of the tooth, into your bone, from your bone into your system. So in a way, it's leaky gut at its worst.
So, wow, that makes a lot of sense.
Now, there's
when
only,
you say it that way.
yeah, I mean, people know when from the mouth to the bottom, it's a tube. It's a sealed tube. We need to keep the outside outside and the inside inside. When there is a break in that tube and the bad stuff gets into your body, it's called leaky gut.
Yeah,
So people
correct.
know leaky gut from their stomach.
Yeah, you bet.
They know that that's bad, right? There's so many different diets to try to repair the leaky gut.
Amazing, yeah.
But in
And
reality,
it is a cause of autoimmune diseases.
absolutely,
Yeah.
absolutely.
Yeah, I mean the leaky gut. So
Leaky
it's
gut
interesting
is.
that talk about the teeth.
Leaky gut starts right here.